Hi, everyone. My name is Alicia Martin, and my article today is Gastrointestinal Issues in the Autism Spectrum Disorder. It has been reported that gastrointestinal disorders, or GI disorders, are among the most prevalent medical conditions that have a comorbidity with individuals who have autism spectrum disorder, or ASD. Because of the disability of the individuals with ASD, the GI diagnosis is often overlooked until their sleep, mood, and behavior change. The initial concern is that children with ASD is they have eating problems. Children with ASD are 5 times more likely to develop feeding problems related to food sensitivity, food refusals, poor oral intake, and with food intake, it's typically based in category and texture. The article reports that GI symptoms are more common with toddlers with ASD than quote unquote typical toddlers or any other subgroup, suggesting that there is something unique about how their GI tract is developed or how it functions. With the different types of GI symptoms, starting with eating problems, then comes constipation, diarrhea, abdominal pain, and GERD, which in children with ASD, they are 4 times more likely to experience these symptoms comparatively. And it also appears that as the severity of ASD increases, so does the incidence of GI disorders. Pica. Pica is the ingestion of non-nutritious items, and it is also another problem for children in neurodevelopment disorders. It is undetermined if pica is the cause of GI problems or if the GI problems already exist and pica exacerbates the symptoms. One study reports that 60% of ASD patients displayed pica at one point of their lives. Because children with ASD are also diagnosed with multiple psychiatric disorders typically, the most common of these is anxiety, and the comorbidity between ASD and anxiety is quite high. The article suggests that behaviors could be correlated to GI symptoms due to many individuals with ASD not being able to verbalize their distress. Along with having these symptoms and them displaying their behaviors, there's also some risk factors that coincide with GI disorders and ASD. One of them is genetic mutations. It has been found that there's a gene that happens with individuals with ASD that also happen with individuals who have GI disorders. Unfortunately, there's not a lot of research that suggests that there's a correlation. Another factor is environmental, which is diet. Study shows that people with ASD have a higher propensity for celiac disease and food allergies. But then we return to our initial problem of eating difficulties. So then the question becomes, if you have a picky eater, do you really want to have a restrictive diet? Along with these factors of genetic mutations and environmental, are also maternal factors, like obesity and diabetes when the child was in utero. This is another study that continues to be explored. And then lastly, the other risk factor is trying to understand the gut and how the gut actually works with individuals who have ASD. So, consequently, dealing with GI distress in individuals with ASD, some of the difficulty is that they have communication problems and sensory perceptions. So it is difficult for them to verbalize their distress. Consequently, children with ASD tend to display their distress with aggression, self injury, irritability, abnormal vocalizations, motor signs, hyperactivity, changes in sleep, and/or anxiety, which we all know can also be criterion for multiple other psychiatric diagnoses. So, the treatment for GI problems in children with ASD is first getting a good interdisciplinary team. By having a team of neurologists, their primary care physician, their social workers, their parents, their teachers, their psychiatrists, gastrointestinal doctors, having them all come with their specialty and their insights into the individual will only give greater outcomes. Then it is suggested that by manipulating the gut has also had some positive success rates. One of the treatments is something called fecal transplant, where they actually take healthy feces from one person and implant it into another, hoping that it'll change their gut. Another less intrusive way is by the use of probiotics. But this is something that is new to research. So there's not a lot of documentation that supports this practice, but it is looking quite promising. In conclusion, if we as clinicians are able to understand that many people with ASD have a predisposition to GI disorders, diagnosing might be easier, treatment more effective, and give the ability to rule out other diagnoses that were socially constructed. Thank you so much.